who would be the people that would be maybe most at risk? If someone's listening to this and they're pregnant for the first time, or they're about to be pregnant for the first time, and they're like, wait, okay, do I have to go do this? Who needs to do this? Like, who would be the ones, if you had to give a couple of categories of people, that would be really good idea to check your progesterone potentially before you conceive in that mid-luteal phase, which would be like 1 week, so 7 days after your suspected ovulation time. So you can get it checked there. And if it's pretty solid there, correct me if I'm wrong, but you're probably going to be okay. But if it's low there, it's
Mm-hmm.
suboptimal, then potentially when you do become pregnant, it's a really good idea to, in that very early phase, 5, 6, 7 weeks pregnant, be testing and ensuring that your progesterone is going up, correct?
Yes, absolutely. So I am a fan of every woman testing,
Yeah.
but
Yeah.
people who would be at higher risk would be someone who's previously been on birth control because maybe they're not able to really adequately get those hormones on board. Someone who is undernourished. And when I say undernourished, that could be that you're not eating enough. It could be that you're not eating nutrient dense foods. So, like, you might be eating a bunch of pasta and bread, but you don't have enough vitamins and minerals. So, your body perceives that as being undernourished. Or you're exercising more than what you're eating. So, any of those can lead to a energy deficit or a lack of the nutrients that your body needs. And progesterone very, very, very much needs a well nourished body. Anyone who's been stressed, stress is a huge killer for progesterone. Same with inflammation. Inflammation is another huge killer for progesterone. And you might not know that you have inflammation, but if you have any symptoms, if you have gut problems or joint pain, or you just feel off, tired, like any honestly symptoms, could be a sign that there's inflammation going on. And then if you have a thyroid condition, and or if you don't know, but you get checked for one, let's say your doctor checks your thyroid or you do it on your own and it's suboptimal or low, then you definitely want to check your progesterone because thyroid also really impacts progesterone. But really, anyone who has done that or has had a history of a loss. So like, let's say you've just lost your baby once, and I see this all the time. People come, they're like, I had one miscarriage. We don't want you to just keep trying and have losses to be put into the category of recurrent pregnancy loss before we look at you. I think that's silly, personally. That's how conventional medicine does it. I don't do it that way. I say, you've already had a loss. Let's figure out what's going on. So even if you're not someone who's had recurrent loss, meaning like 2 or more, you can still do this investigation and look at these things. And absolutely, if you've had a loss in those early weeks, especially, do that investigation before you get pregnant again, because you could potentially prevent another loss.